should reset the scripture. Let me see. Check. Start.
Devin, this is yours? I can move it next to mine. There's one chair there, that way if you move it, more chairs. There's 4 chairs here. Right.
Yeah. Good afternoon, everybody. Can everybody hear me? Everybody hear me okay? Good. Okay, well, it is 1 o'clock. I'd like to start right on time. This is the sonography and echocardiography and vascular technology information session. I'm the program director, Jose Rodriguez. I've been the program director since last April. So this April will be 1 year. So I'm still kind of new in the game, but I've been with the program for almost 20 years. In the fall will be 20 years. So I do know the ins and outs of the program itself, or actually of the programs. Just to let you know, we are recording this session via WebEx, and we are recording myself as well via video and audio. So just to let you know. So we'll try to not say anything that we don't want to say today, right? Because it'll be recorded. First of all, thank you for coming. We are requiring these information sessions to be face-to-face. We want to make sure you have the latest information before you apply, and make sure there is no confusion about the application process, about what we do, and all those things, okay? So welcome. Thank you for taking the time to come out to join us. So the first thing I want to do is show off our programs. Okay, I am very proud of our sonography programs. Again, I mentioned to you guys, I've been here for about almost 20 years since the start of the programs. So, I mean, really, if you ask anybody in the sonography field, they'll tell you that Lone Star is a great program. We are an elite program. Okay, so that it really is the buzz around town. I have friends that are program directors in other programs around the city, and they say, your program is very popular, it's very good. You have a lot of great things, a lot of graduates, a lot of great equipment, etc. Okay. So again, yes, I am biased, but I do get these anecdotal testimonials from around the area, okay? Just to let you know, I'm constantly getting emails and phone calls from local facilities that want to hire our students, okay? We do graduate, not a big number compared to nursing or radiology programs, but we do graduate about 15 students approximately a year. And there's a lot more positions out in this greater Houston area than 15, okay? Because usually our students will graduate, will get a position in sonography, and I'm still getting calls, we need more students, we need more graduates, we need more sonographers. So you're the sonography is a good field, promising field. Something else about our program, we started in 2003 with the diagnostic medical sonography program. Then we started a vascular certificate program in 2007, and then our echo program in 2010. So we have a lot of experience in teaching students this profession. Okay. Something else that you need to know about our program is that all the programs that we have here in sonography are accredited. Okay. Shopping around, that's the first thing I would ask. Is your program accredited? Okay. We'll talk about what the accreditation means in just a moment. As far as job placement, as I mentioned, our students graduate. They're usually picked up or hired by the facilities that they are rotating through. We have clinical affiliations all over the greater Houston areas that accommodate our students. Upon graduation, they grab them, they hire them. Okay. We have an excellent track record of passing credentialing examinations. Okay. Historically, I'm very confident to say about 99% of our students pass the boards. Okay. 98% pass them on the first try. Okay. So our faculty members know what's on the credentialing examinations, They relay that to you. And of course, as long as you pass our courses, as long as you graduate from our programs, be confident that you'll pass these boards. I'm pretty confident that you'll obtain a position in sonography. And then just to close on this show-off slide, I don't know what else to call it. Some testimonials regarding our clinical partners. Again, our clinical partners have told me face-to-face, I will only hire your students. I will only hire Lone Star students, okay? Because there's a lot of programs out there, I'm sure you know. There's a lot of programs out there in the Houston area. They even say, you know, which is a great compliment, your students are better than other programs. We're not going to name the other programs around the Houston area. We're just focused on our programs, right? On the Lone Star College-CyFair programs. This is the agenda for today. We're going to talk about what is a sonographer. We're going to talk about the technical standards that are needed to become a sonographer. We'll talk about our program, the details, the ins and outs of the programs, what to expect as a student. I'll go through the application process via the website. And thank you for your patience on the website. I've been working on it for the past year. So there's been, you know, some new information here and there, some edits here and there. They've allowed me to have full access of the sonography website only for the CyFair campus, okay? We also have a system website that I cannot touch, so, but anyways, I'll let you know the difference between those two websites. And then at the end, we'll have the Q&A session. So you can please hold your questions. We'll address them at the end of my presentation, okay? Deanna and Devin, WebEx is going okay? So what is a diagnostic medical sonographer? And we're going to let the Society of Diagnostic Medical Sonography, which is one of our organizations for sonography, tell us what a sonographer is and what that entails, okay?
Sonographers are an elite group of medical professionals who use ultrasound.
You guys hear okay? A little bit louder?
Sonographers are an elite group of medical professionals who use ultrasound technology to see the body's organs, tissues, blood vessels, and musculature. Sonographers are on the front line in the early detection and evaluation of high-risk pregnancies, women's health issues, cancers, heart defects, and arterial blockages. The sonographer uses their knowledge of anatomy, physiology, and physics to place a small device called a transducer against the skin in the area to be imaged. The transducer sends high-frequency sound waves into the body, which are bounced off internal structures in the body. After the sonographer makes the necessary adjustments on the ultrasound machine, a computer analyzes the reflected sound waves and creates an image of the structure. But unlike X-rays, no radiation is used. Sonographers can specialize and be certified in scanning different areas of the body. Abdominal sonography captures images in the abdominal cavity. OB/GYN sonography focuses on women's health issues, including pregnancy. Musculoskeletal sonography concentrates on muscle, ligaments, tendons, and joints. Cardiac sonography evaluates the heart and its blood flow. Vascular sonography evaluates the blood flow of peripheral and abdominal blood vessels. And breast sonography confirms the presence of cysts and tumors. Sonographers work closely with physicians and care providers to diagnose disease, and they're employed by hospitals, physicians' offices, walk-in clinics, and medical and diagnostic labs. It's an exciting and challenging career with tremendous opportunity. The Bureau of Labor Statistics predicts employment growth of about 26% between now and 2024, which is more than most professions. The median base hourly wage for sonographers is $34 per hour, which is over $70,000 per year based on a 40-hour work week. Sound interesting? The Society of Diagnostic Medical Sonography is an excellent resource to help you learn more about becoming a sonographer, getting certified, continuing your education in the industry, and getting the assistance you need to advance your career. Picture this rewarding career as yours. Visit sdms.org today.
So as SDMS describes it, very exciting, very promising field, right? They also described it, they used a term to describe it also at the end there. They said the word challenging, okay? And we're gonna talk about what that means for us, okay? So. Okay, so just moving on, let's discuss the differences between a general sonographer and a cardiac sonographer, because those are the two programs that we offer here. And I want you to make sure that, I want you to understand the differences between those two. Yes, they're both sonographers. Yes, they're both first responders, but they're different professions, okay? We do perform the examinations on the same system, on an ultrasound imaging system, okay? But again, we are imaging different parts of the body, and we do different things. For the general sonographer, usually we scan abdominal studies, liver, gallbladder, pancreas, kidneys, things of that sort. The most common one, or what people think about when we hear sonography or ultrasound, OBGYN, right? Pregnant moms and things of that sort. A general sonographer also scans small parts. That includes thyroid, breast, scrotum, things of that sort. And within our programs, we do offer non-invasive vascular sonography, which is very high in demand right now. Again, depending on the department that you work for, sometimes you'll perform, or for the most part, you'll perform vascular studies. Some departments do not perform vascular studies. General sonographers scan with the right hand. There are intimate examinations involved with a general sonographer. There's a pelvic or gyn examination that general sonographers perform. That includes a transvaginal probe that we use. So intimate exams in that sense, breast sonography, obviously very intimate. Usually the general sonographers are housed under the radiology department. Now the cardiac sonographers, they're typically scanning the heart, okay, on all patients. Again, in our program, we will offer this vascular study training, which go hand in hand with cardiac. It makes sense, right? Heart and the vascularity of the body goes hand in hand. Cardiac sonographers scan with their left hand. Any left-handers here? About 20% of the population, right? I'm kidding. Either hand that you use will train you to scan either left-handed or right-handed, depending on what program you choose. There are intimate exams in cardiac as well. So when you're scanning the heart, for females, obviously the breast can get in the way. So we have to professionally ask the patient, please move your breast out of the way to get a nice window to view your heart. So things of that sort. And a cardiac sonographer is usually housed under the cardiology department. And so you're dealing a lot with cardiologists that are reading your examinations. Now notice that I said sonographer. Did I say technician at any point in time? Have you guys ever heard of ultrasound tech? Ultrasound technician? Okay. And that's correct in a sense. We wouldn't like to use that term. Okay. No offense to technicians, but when you want to become a sonographer, whether it's cardiac or general, usually the schooling is about 2 years. It's an associate's, you actually get an associate's degree nowadays. There's a lot of schools for sonographers. And so, because we are getting an award, a degree, our profession is now referred to as sonography, and therefore we're sonographers. Okay. Yes, maybe 30, 40 years ago, the training for a sonographer was typically on the job, might take a couple of months. And so they refer to us as ultrasound technicians. But if I teach you anything today, let's call each other sonographers or future sonographers. We're okay with that? Awesome, great. Starting a movement here. So as I mentioned, I want to stress to you guys that these are different professions. Can you apply for both programs? Yes, you can. But I highly encourage you to research both fields. Again, as I mentioned, they're not the same, okay? There's some big differences in there. And so research the professions. If you can do some shadowing of some sort, maybe you have some connections from the hospital or a doctor's office or a sonographer, take advantage of those things. There's a few of you that I've had throughout the years that can do that. Majority you can't, but I don't know, YouTube videos, read about the professions, what they do, and try to decide what you want to be, okay? Continuing on with this profession, please note that you do have to complete or pass 2 credentialing examinations in order to practice as a sonographer. There's a sonography principles instrumentation examination, which is your physics or ultrasound physics exam, and then your specialty. If you want to be a cardiac sonographer, of course, you take that specialized board with regards to cardiac. If you want to be a general sonographer, then you have the options to take abdominal specialty, OBGYN specialty. And then if you go through the vascular training, of course, there's a vascular specialty exam for that. So there's many credentialing examinations. Again, you need 2 to become a fully credentialed sonographer and be able to practice here in the state of Texas. But again, as I mentioned before, we've been in this sonography education business for a long time. Again, we will train you and expose you to what is on these credentialing boards. As long as you give us your best effort, you pass our courses, you should be pretty confident upon graduation to pass these boards, to take them, pass them on the first try. Moving on to technical standards for a diagnostic medical sonography student or a sonographer. So there's 3 learning domains: affective, what is your mood, what is your personality, how do you behave, things of that sort. There's a cognitive area in sonography. Do you understand when we are teaching you something? Can you follow instructions? Okay. And the last portion is psychomotor skills. You need to have good, fine psychomotor skills in order to move the transducer to specific areas of the body. In lab, we're going to ask you, rotate the transducer 90 degrees. We're going to tell you to move the transducer to different parts of the body, etc., things of that sort. And they're very precise moves that we're going to train you to do. Critical thinking. You need to have critical thinking in order to become a sonographer. I know nowadays, there's lots of memorization. That's not good enough, right? All the knowledge that we're going to train you from semester to semester, you're going to use that to the end of the program until you become a sonographer and continue using that knowledge. So it's not just about memorization, it's about critical thinking. Your interpersonal communication and behaviors with others. You need to establish good rapport and work effectively with patients and colleagues. Are you going to be in a good mood when you're scanning a patient that's sick? How are you going to behave when you're relaying information to other healthcare workers? You have a bad attitude? Can you communicate effectively and accurately? Okay. So you need those standards as a sonographer. I like this one right here. Possess emotional stability. I remember a student, I was asking, this was when I was teaching, I asked the class, why did you get into sonography? And her response was, I wanted a less stressful job. You think it's stressful in the healthcare field? Yeah, it can get pretty stressful. We need that sonogram as soon as possible. We need that sonogram now. You need to go to the ER and get that patient that's bleeding, bring them over to the department and scan it now. I need the results right now. As soon as you're done, I need the results. Okay, there's a lot of pressure, okay, to do things quickly. So we have to react accordingly. Let's see, communication, effective communication, accurate communication. Mobility. Nowadays, sonograms are performed at bedside. Okay. Back then, hospitals had transporters. They would go grab, go get the patient from their rooms, transport them to the sonogram department. We perform the exam there. A lot of times now, we go to the patient, so we won't have to move them. Okay, so you need to be able to grab that sonography machine, take it up to the patient's rooms. Sometimes patient rooms are really small. It's sort of like an optical course sometimes. So you need to have good mobility. We're standing up a lot of the time. Usually when we scan at bedside, we're standing. There is no chair. Down in the department, there probably is chairs where you can sit down and scan sitting down. But most of the time we are standing up. Usually medical shifts are from 8 to 12-hour shifts. So be able to stand up and walk for long periods of time. There was a student that we had accepted a couple years ago that had back issues. She had to drop because she couldn't, she couldn't do this. Okay. As I mentioned, motor fine skills are needed to scan, to move the patient, to push the ultrasound unit. We need to, sometimes we're pushing stretchers, okay, that are very heavy, up to 500 pounds. Of course, we don't feel those 500 pounds because they're stretchers that have shocks and good wheels and good locks and things of that sort. But you do need some strength to push those stretchers around. Your hearing needs to be good. The ultrasound system will have audible sounds with different pitches. We need to know what those pitches mean. We'll have increased loudness of the sound, decreased loudness. We need to know what that means, etc. So you need to be able to hear those things. Visually, you need to be able to differentiate colors, differentiate different shades of blacks and whites and grays and things of that sort. So those are the technical standards. I just mentioned a few, but there's that list right there. And again, we'll mention that once you're accepted to the program as well, because we're going to hold you to that standard. We need you to have these. We'll train you to obtain these abilities and these technical standards, because that is a standard we need to become a sonographer. Okay, let's talk about our programs, our sonography programs. The first one is our Diagnostic Medical Sonography program, or RDMS program. It is an associate's degree in applied science. And we also have our non-invasive vascular certificate program. Okay. In these two programs, as I mentioned before, we will train you in abdominal sonography, small parts OBGYN, and if you decide to, the vascular portion of the program. Okay. Let's have some fun here. Can anybody tell me what this looks like? Sorry? Baby head. Oh, wow, being very specific. I was just expecting baby. Okay, baby head, good. What about over here? Anybody see a kidney? Who said that? Potential sonographer. Hey, I know you. Potential sonographer, future sonographer. What about over here? What do you think this is? What's going on over here in this image here? An artery. Why an artery, not a vein? Because it's red. Okay. What about this right here? Pulse. Ooh, very good. All right, we have future sonographers in here already. Very good. Okay. Just to let you know, these two programs are embedded simultaneously. So you can take the A.A.S degree in DMS and the Vascular Certificate program as well. Okay. Our other program is our Adult Echocardiography program. It's also an A.A.S degree. And we will also teach you the vascular portion of this program as well. Okay. They do run simultaneously as well, just like the DMS program. All right, let's see if you guys can guess what this is. Heart, very good. Can you guys see 4 chambers? 1, 2, 3, 4. Some of you? Those of you taking that maybe anatomy and physiology already? Good. And of course, this is our vascular image right here. Very good. So the 2 programs that we offer, the DMS, the Echo, and again, this vascular certificate program. Now, there's been some curriculum proposal changes that should be effective by fall of 23, which is this incoming cohort. Basically, what's going to happen is we're going to combine these A.A.S degrees to the certificate degree. Okay, so if you apply for the DMS program and you get in, you'll be trained in vascular as well. Okay, currently, this current cohort right now that's going through our program has the option to say, no, I don't want to do vascular. Okay, they have that option right now. Okay, but because our community members are saying we need vascular training, whether they are DMS sonographers or whether they're echo sonographers, we need that vascular training. Okay, so it's coming from the community. So again, what we're proposing is, actually it's in process right now. It's in system office currently. I'm about 98% sure that it will be approved. Okay, so basically this slide is just telling us that we're combining the vascular and the DMS and the vascular and the echo. Okay, you're getting vascular regardless, starting in the fall, which if you're applying this year, that's what you're going to be. I was talking about program accreditation. As I mentioned at the beginning of the presentation, we are an accredited program. We're accredited for DMS, we're accredited for echo, and we're accredited for vascular. Okay, why is that important to know? Because if you graduate from an accredited program, you're eligible to take the credentialing boards. Okay, there's some schools out there that are not accredited, and if you graduate from the program, you may or may not be able to take your credentialing boards. Sounds like a waste of time to me. What do you think? So these are accrediting bodies, KHEP and JRC DMS. You can copy the web addresses. You can look up our programs and confirm that they are accredited. But we've been accredited since the beginning. Okay. As soon as we established all these programs, we apply for accreditation immediately, and we've been granted accreditation. So we've been accredited for a long time. Because we are accredited, we're promising these things. Okay, these are minimum expectations. If you graduate from our programs, you should be coming out as an entry-level competent sonographer. You should be able to pass your boards on the first try. Okay, and you should be professional. We're going to see your professionalism. Actually, that's one of your technical standards, to be professional, and also be compassionate towards your patients. Okay. So whether you're in the DMS or in the echo program, this is what we're promising you. Again, as long as you give us your best effort, as long as you pass our courses and graduate from our program, that's where you're going to be. Program length and details. We're currently accepting 16 students in the sonography program or the DMS program and 16 in the echo program. I know it's not a lot, and I'll give you a little spiel. Okay. Whereas nursing can place 20 students in one hospital, we can only place 1 student in one hospital. Okay. So we actually have about 50 affiliated clinical sites that we use just for our students. Okay. So that's the issue. And then again, we're competing with other programs around the area. So this is where our number is, at least for this coming year. Are we looking into increasing it? Yes, incrementally. Maybe 1 or 2 in 1 year, in 2 years, in 3 years, things like that. Nothing like, oh yeah, we're going to accept 30 students next year. That's probably not going to happen. Very competitive, right? We started in the fall. It's a total of 5 semesters. So fall, spring, summer, all of summer. And then in a second fall and a second spring, you graduate in May. It is a full-time program. Okay, both programs are full-time. No more than 40 hours per week, approximately 7 to 5, typically Monday through Friday. And this is not counting study time. Okay. So Our students are constantly studying, constantly focusing on sonography. And yes, it's tough. It is a sacrifice. But I tell my students, it's only temporary. It's only 5 semesters of your life. Clinical rotation days. There is an internship portion in this program where you're going to be rotating through the hospital, shadowing sonographers, performing examinations. I'll talk about that in just a moment. Clinical rotation days can vary to include weekends and evenings. Okay. Yes, our program is a day program. However, if clinical sites one day say, sorry, we can only accommodate your students on the weekends and in the afternoons, we're going to say, we'll take it. Okay. Because we're guests in their facility, we're not paying them to accommodate you and to teach you. So we'll take whatever we can. Lectures, lab, and clinical rotations are typically face-to-face. Clinical obviously is face-to-face. Lab is face-to-face. Lecture, some professors will have some online components to the lectures. That'll differentiate between the programs and between the courses. There's also optional after-hours scanning lab. So typically we'll have sophomore students or second-year sonography students apply as a lab assistant. They'll open up the labs for you guys, and you guys have the opportunity to scan after hours. The more you scan, the better you get. The more you scan, the faster you get scanning. Okay, so it's very important. So some details about clinical rotations or the internship portion of this program. Again, start times will vary. Again, we try to keep it to a Monday through Friday schedule, to a day schedule for the most part. But again, just FYI, letting you know now, so you won't tell me when you're accepted. You didn't tell me I had to rotate on the weekends for a clinical, so that can happen. Your clinical shifts range from about 8 to 10 hours depending on the semester. The first semester, depending on the program that you're in, it's either 1 day of clinical rotations or 2 days of clinical rotations. After that, from second semester to the end of the program is 3 days a week. It is a lot. You will be tired. Second semester, you'll feel it. Be very tired. You have the opportunity to observe the daily routines of the sonography department, cardiac department, etc. Shadowing sonographers. Whatever the sonographer entails, that's what you'll be observing. Eventually, they'll let you become involved and actually scan patients. You will be scanning patients under supervision, of course. You will be exposed to bodily fluids, blood, etc. So be aware of that. You will be interacting with healthcare professionals. You'll be interacting with physicians. You'll be interacting with patients. We live in one of the largest cities in the United States, so significant travel is required. Look at our clinical sites, guys, all over the greater Houston area. When I say greater, I mean College Station. I mean the medical center. We're utilizing Huntsville Medical Center, Kingwood, the Woodlands, Sugarland, CyFair, Katy, and everything in between. So you will be driving. Estimated program costs. For the A.A.S degree, because of inflation and all that, et cetera, I bumped it up by about $2,000 or so. So this is an approximation, $17,500. If you do also are involved in the vascular program, add $2,000 to that. So under 20, under 18, approximately, something of that sort, okay, for the entire program, for all 5 semesters. If you want something more specific, the fall semester, whether you're Echo or SONO, it's about $5,000 or so. Just be prepared to pay that. These estimations include the tuition, uniforms, textbooks, etc. All these things here. If you want to look at the tuition rates, you can log into LSC. It's about less than $200 per credit hours, something like that. Something also very important, guys, for financial aid. I always emphasize financial aid, and maybe some of you are like, no, director, I'm not going to apply because I'll get denied. Well, my counter to that is to please apply anyways, even though you get denied, because if something happens, you're in a bind. I tell you to come to me if you're in a financial bind. Come to me to see if there's resources. I go to financial aid. The first thing they ask me, did the student apply for financial aid? And if you didn't, they can't help you, okay? But if I tell them, yes, they did apply for financial aid, here's their information, they will try to find funds for you, okay? Nothing is guaranteed, but highly emphasized to apply for financial aid. Please note that there's also scholarships. There's this Workforce Solutions scholarships. You do have to qualify for it, but hey, if you qualify for it, excellent. This scholarship actually pays for your credentialing examinations when you graduate. Those are about $250 a pop, so, you know. So please apply for these things, especially financially. Now, what to expect when you're in our program? I go through this through my information session students, and I looked up a good word that will describe our program, and I came up with rigorous. So I looked it up. This is the Google definition for rigorous. Characterized by or adhering to strict standards or methods, and we are very strict. Okay. Exacting and thorough. We need to be thorough as sonographers. We're looking for pathology in these patients. Should we be thorough? Or should we, I might have missed something, I'm not sure. Next patient, what do y'all think? Thorough? Yes, good. Glad you agree. Harsh, severe, and demanding. Look familiar. At points and times, guys, at moments during the program, it'll be harsh, it'll be severe, it'll be demanding. This is not good enough, you need to do it again. Not good enough, you need to do it again. Not good enough, try tomorrow. Okay? Very unpleasant or inclement. We're not going to be unprofessional here. I'm not talking about being a professional towards you. It's just, sorry, this is not good enough. Our standard is up here. You need to get up here. Does that make sense? I'm going to talk about professionalism in just a moment. So I mentioned we're strict. We have a lot of program standards and guidelines since day one. Remember, I've been here since day one, since 2003. Students have broken rules and policies because we didn't have any policies in place in the beginning. I mean, we had a few, but not so many. Okay. So the student handbook became from maybe 10 pages to about 40 pages now. Okay. Because every year a student would, be sneaky and break policy, and we didn't have a policy for it. So, okay, got to write another policy because what if this happens, or what if the student does this or that? So we are very strict. Why? Because we want you to succeed. Okay? Once you're in our program, we don't want to get rid of you. I hope I'm not giving that impression. Once you're in our program, we want you to succeed. We're going to do whatever it takes for you to succeed, to stay in the program, to graduate, and become a sonography professional. That is the intent here. Again, we're running a premier program here, and we are forming you to a higher standard. Okay. If not, we wouldn't be getting these compliments from our affiliated clinical sites. If not, they wouldn't be hiring our students. If we weren't setting you up for this higher standard than the next program. Okay, that's what they want. That's why these clinical affiliates, these medical facilities want our students. Grade policy. You need to maintain a 75% in all program courses. Okay, that's different than your typical 70%, right? Let's say for college algebra or composition or whatever. You have to maintain a minimum of 75% to be in our program, in our courses, okay? The reason why is because these credentialing exams, you need to have an 80% to pass these credentialing examinations, okay? So we're going to hold you to close to that standard. Maybe we should push it to 80%, okay? We're going to hold you to a 75% minimum standard for all your courses. You got to maintain a 75% or above to pass the courses to go on to the next semester, okay? So that when you graduate, you pass the examinations with no problems. You pass it on the first try, okay? Like most of our graduates have done. Attendance policy, 3 absences in the fall and spring, 2 absences in the summer. So we require dedication, guys. It takes dedication to become a sonographer. You can't miss too many days. If you miss too many days, you are behind already. It's hard to catch you up. That's why they have this strict absence policy. We do not tolerate unprofessionalism. If you violate a policy, if you're unprofessional, if you're not compliant, we'll give you a warning. Say, this is what you did wrong. Don't do it again. You'll slap in the hand. Okay, you get a warning. Next time you're on program probation. Okay, meaning if you get a second or actually a third violation, we dismiss you. Not only do our clinical partners hire our students because they scan well, because they pass their boards, because they're compassionate, but also because they're professional and very respectful. They don't have this entitled attitude. They're very professional. Again, we have these strict standards because this is what we want our clinical partners to say about us. Okay, we want to continue this legacy from here on out. Dress code, we do have a dress code. These are the current uniforms right now. They're gray. However, the clinical coordinators want to change the color. So anyways, you'll find out what that color is when you get accepted to the program. Just some more dress code items, just to kind of give you a heads up. So you'll be in uniform whether you're in class or whether you're in clinical. Hair of natural color. Sorry, no blues, no purples. I know that's kind of common right now, but gotta have natural color. It's coming from our clinical sites. Long hair needs to be pulled up if you have long hair. Facial hair, gentlemen, make sure if you have a beard, just neatly trimmed. Artificial nails need to be trimmed. Tattoos need to be covered. 1 piercing per earlobe. And then again, that scrub color change is coming soon. So just kind of giving you a heads up as far as what the standards is for the dress code. And this is coming from our clinical partners, from our clinical sites. This is what they want. Oops, sorry. That was a video. Okay, so let's go on to the application process. I'm going to escape here. Let's see. Let me do this. I want to kind of guide you on how to go when you get back home or what have you. Just to go to our website, okay? Here's the main webpage, lonestar.edu. What I do is I go to this magnifying glass and I type in sonography. And the same requirements for sonography also are the same for echocardiography, okay? You can just type in sonography. You're going to get a couple of searches here. And I go to this 5th choice here where it says requirements, okay? This will take you directly to the LSC-CyFair sonography website. Because as I mentioned, there's a system website for sonography, which I try to ask them to update it as much as I can, but I cannot edit that website. So my edits and the most accurate information is here, right? So I click on it. I'm sure you're familiar with it. You should be kind of looking into our website and getting familiar with it, etc. Here's the website that I start off with. This is notification of pending program changes. I already talked about. We're going to combine the awards, the A.A.S degree with the certificate degree. Here's our information session link, which I'm sure you're familiar with because you're here. I clicked on it, and I'm going to click on the acknowledgement form. Someone actually has it or brought it. You don't need it today. I click on it, and after we're done with the information session, download it, sign it, date it. You're going to upload it to the application. Okay? You don't need it right now. Just FYI. Steps to prepare for the program application, important dates. If you're attending different institutions other than Lone Star, or you have attended different institutions, you got to send us your transcript request form. Deadline's coming up by the 15th. So make sure you take care of that. So we can have all your records from these other institutions, okay? If you've only attended Lone Star College, you don't need to do that. We have all your records already in our system. Program application, it's open now. If you wanted to submit your application, you can do so already, okay? Application deadline, May 23rd at 12 p.m. We even have a timestamp on there. You think students have turned in applications at 1 o'clock? You guys laugh. What do you think, yes or no? Do we accept those applications? We don't. You're not following instructions, okay? So please, guys, there's the dates. Make sure you do that, okay? I'm going to scroll down to the how to apply link, as it says here. I'm going to scroll down to the how to apply link. I click on it, and those are step-by-step instructions on how to apply to our program, okay? You click on this link, it'll take you to the application webpage. It should be live. It should be live already. There's an examination that you have to take in order to apply to our program. It's called the Pegasus Ultrasound Student Assessment, or the USA. Some of you have probably taken it already. You take it here at the assessment center. You schedule it actually through the assessment center. You click on it, it'll take you to the assessment center website and just follow instructions. Okay. I'm going to scroll down to the USA Pegasus exam. There it is, Pegasus USA, and just follow the instructions. A few more details in just a moment about the Pegasus. I have actually a PowerPoint slide on that. I'm not going to talk about student orientation. That's only once you're accepted. Immunizations and titers. You have to complete immunizations and titers. Deadline is June 29th. Again, only for accepted students. Okay, I'll talk about that in just a moment via a slide in my presentation. Just want to talk about one immunization that can take a couple of months to complete. So just FYI. Prerequisite courses, you should be familiar with the prerequisite courses already. English or Composition 1, Math 1314 and College Algebra, Physics 1410, Elementary Physics, and your Intro to Anatomy Physiology, Biology 2404. Biologists need to be within 5 years. And there's exceptions to some of these courses that you should be familiar with. Everything is all here, guys. Okay. Go back to my presentation here. But just a little bit of details regarding the application process. Now, how do we figure out who gets in, who gets out? Well, we have this worksheet that tells you how to get into our program. I'm back at the web page. This is the worksheet that I'm talking about. Selection process worksheet. I'm going to click on it, and there it is. About half your application points, guys, come from the prerequisites. If you get an A, let's say in Biology 2404, you get 12 points. If you get a B, you get 9 points. If you get a C, you get 6 points. If it's a transfer credit, you only get 6 points. So it's just FYI. And so that's how we start ranking you. Okay. Yes, we want the A and B group, right? The other half, approximately, with regards to the application, is that USA examination, that Pegasus USA examination. Okay. Ultrasound student assessment, and I'm going to talk about it in just a moment. Okay. You're going to get a score Actually, going to get multiple scores. I'll talk about it in just a moment. And we're only going to use the clinical score. We have a little formula. You multiply your score by 0.5. That's how many points you get. And then you have your co-requisites. Okay. It is an associate's degree program. So you have to take Sociology 1301 as a co-requisite. If you take it, you get 1 point in this category. And you also have to take a course with regards to creative arts or language, philosophy. I mean, there's just a list of what we accept with regards to these categories here. If you take it, you get another point. So even if you take those co-requisites, that'll help you get in. Okay. The cutoff might be 1 point to get in. Well, the difference between you, someone getting in, and someone getting out could be 1 point. Program application, as I said, it is live now. You guys can apply if you wanted to. You will have a choice to apply for sonography or for echocardiography or for both. But remember what I told you. Want to be a fireman or do you want to be a policeman? You should know what you want to be. Okay, so just some details about this Pegasus USA examination. It is an aptitude test. Okay. It sort of predicts if you can be taught these things that are needed to become a sonographer. Okay. I can't tell you what those things are. You'll find out in the examination. But it is a true aptitude test. It's not going to test you on, you know, astronomy or anatomy, physiology. You know, it's not going to test you on those things. It's going to test you on things that have been identified in sonographers and things that are identified in successful sonography students. Okay. And I can tell you a few of the categories because I do mention some hidden categories in our worksheet that I just shared with you. So there's no secret. I mean, it's kind of secretive because we don't want you guys to tell once you take the examination. We don't want you to tell the next student what's in the examination. Okay. But just to show you, because we're not trying to hide anything here, in the worksheet, selection process worksheet, if you scroll down, these are some categories in that exam. Okay. Remember, we're just looking at your clinical score. Oops. Oh, sorry. Hey, sorry. Oh, where's IT? Why is it doing that? Let's try this again. Get away from there. You guys call the IT people, Deanna, where's Deanna? Hey, Deanna. Might be doing something wrong, sure. Okay, let's see. Are the IT guys out there? Linda, can you check if the IT guy is there? Sorry?
Try the keyboard.
Try the keyboard. Kind of like stuck on it. It's like fighting with me. Maybe. Okay, I'll come back. Sorry, guys. Let me come back. Pressing something. Okay, so I'll come back to that. I'll try to come back to that. No OTP, no OTS people out there? Come on, I'm almost done. Clicker.
What happened? What were you trying to do? Play a video?
Okay, I think it's working now. Maybe? Okay,
Yeah.
okay, good, sorry. I think it was the mouse. I'm sure I did it. Anyways, you can take this examination already. Please schedule it. There is a fee to it. There's $50 out of your pocket. So make sure you schedule it through our testing center. And they'll give you details on how to pay for it and to schedule it and things of that sort, okay? What I wanted to mention, because again, we're getting some questions about the results of this USA exam, okay? And so this is what the results look like. And so again, so one of the categories is physics, so there you go, okay? So one of the things they're gonna test you on is physics. Okay? The other section is clinical, which this is what we're looking at least this year. We're gonna look at your clinical score, okay? And there's also another section, question analysis. So for this year, we're disregarding question analysis, somewhat disregarding physics, and we're looking at your clinical score. This student actually scored a 1 on the exam, okay? So remember the little formula I gave you? Okay, it'll be 1 times 0.5, and that's the points in that category that you're gonna get. And that's how many points you're gonna have in your application. Okay. You can score a negative score, by the way. And the highest you can score is 120. That's very rare. According to the creator of this examination, who is a sonographer and a mathematician, the highest score you can score is 120. He's seen that rarely, but usually the scores are from 0 to 100. Okay. Now, some of the students' questions are, what is this red little dot here? Sorry. Yeah. Sorry, I forgot to show. This is the average right here. So all these students that have been taking this exam this year, it'll give you an average as far as the scores in the test. Okay, whoever's been taking it. Okay. And I'll also give you this green line. That's a standard deviation line right there. Okay, to see how well you scored compared to others. So if I scored a 1 in the clinical section of the USA examination, how well did I do? Not good, huh? Not good at all. If I were to score a 50, that's the average score. If I score a 60, I'm scoring above average. If I score 100, wow, I should be a sonographer ASAP, because I can do this, okay? Again, it's a predictability aptitude test. It's not perfect, but we're utilizing it for this application period. Hopefully it'll help us choose the best candidates for the programs. Okay, immunizations and titers and miscellaneous items. So again, if you're accepted, these items are due June 29th. We'll remind you once you are accepted. And the second bullet point, hepatitis B shot series, that's the one I was talking about. That immunization, there's multiple, and it could take up to 6 months to complete. So if you haven't done this, you're really serious about applying to our program, trying to get in, make sure you have enough time to complete that immunization before June 29th, okay? If you've completed titers already, please note that our titers expire in 5 years. Again, this is coming from a clinical sites. They want you immunized and titers and things of that sort. If you want to take a look at the the immunization list, it's in the website. So I'm back to our website. I'm going to scroll down, and there should be a checklist. This clinical site required immunization checklist. Click on that. Review the list on your own. There it is, TB, hepatitis B, MMR, varicella, etc. All the immunizations that you have to complete are here. Okay, so make sure to take a look at those so that you're aware of what immunizations are required. Very importantly, guys, we're going to do a background check on you. It needs to be clear. Okay? If it's not clear, we can't accept you because hospitals would not accept unclear background checks. Same thing with drug screenings. You will have to complete a uric drug screen. It needs to be negative. Okay? Sorry, no drugs. Stay away from the drugs. Okay? Negative uric drug screen. And then there's CPR and other things that you can take a look at in that checklist. And again, once you're accepted, we'll remind you of those items. Hey, you need to complete these items and we'll give you a deadline. Is anybody here not 18 yet? Is everybody 18 and above? Good. Last year, let's say the deadline was May 23rd last year, okay? We had a student that turned 18 on May 24th. Did we accept that student?
Yeah. Oh, sorry.
You must be 18 years old.
I'm a softie.
You're a softie? We're sorry, we're not softies, as you can tell. If you are accepted to our program, we will notify you via email. This will happen in late May, early June, okay? Guys, do not send us emails. Have I been accepted on May 23rd, May 29th, June 1st? If we haven't sent you anything, a notification by the second week of June, yeah, start emailing us, okay? Something, we might have missed you or something like that, okay? But you should get an email, again, during this time frame, whether you're accepted, whether you're denied, or whether you're an alternate, okay? And if you're an alternate, please don't get discouraged. Historically, students are accepted into our program and a few drop, or whatever it is. So we'll call the alternates up. Hey, do you want a position in the sonography program, in the echocardiography program? You ready? If you're accepted, we'll have this mandatory new student orientation. Again, details will come about when you are accepted and when you're an alternate as well. If you're an alternate, if you want to stay as an alternate, you have to attend this mandatory new student orientation. Again, when we notify you that you are an alternate or you've been accepted, I'm going to send you an email. Please sign this intent to enroll form. That tells us that you want a position in the program. If we don't get that by a certain deadline, because I will give you a deadline, we move on to the next person, okay? So again, just, be watching out for your email, your My Lone Star email. Okay, we're not going to send it to your Gmail or to your personal email. Please, these emails will be going to your My Lone Star email. Information session acknowledgement form, I already went over that. I showed you how to access it, download it, submit it into your application, to that web online application. Okay. Now, again, the application period is open. We've been getting some applications, and guess what? The acknowledgement form is from 2021, okay? Or from 2 years ago. We're going to reject that and unsubmit your application. We will notify you, okay? Usually students, once they complete their application, they submit it, and we check for your documents to make sure that they are current, okay? If your application, for some reason, is from 2020, we're going to reject that and unsubmit your application and let you know to, hey, you need to take care of these items, okay? They're not current, okay? So, and that happens, guys. Students have been trying to get to our program for a couple of years. Okay. Some of our students, I ask them, hey, how long did it take you to get in? 2 years, 3 years. So that happens. Okay. Question for you. Do you still want to be a sonographer? After all that spiel, do you still want to be a sonographer? I don't need any hands. But to help you decide is, if you took an anatomy course, or you're taking it now, do you like it? Is it interesting? If it is, that's a good thing. Might be future sonographer. Your elementary physics course, or your general physics course that you've taken or you've taken, I know not a lot of people like physics because I used to teach the ultrasound physics portion of the course, and I would ask, and maybe like two of the guys from like 30 students, two of the guys, yeah, I like physics. And everybody else, not really. Maybe one of the ladies, yeah, I like it, okay? But what I tell them, in these physical principles, yeah, they're not easy and there's math and there's formulas, but can you accept the way physics works? If you accept the way physics works, yeah, I can work with that, then you'll be okay with ultrasound physics, okay? Do you enjoy helping people? Do you enjoy helping the elderly, the sick? Okay. Have you been involved in patient care? And if you have, do you like that? Do you see yourself, helping patients? Because that's what we do. This is about patient care. It's not about us. Okay. Do I have an investigative mindset? Okay. When we locate pathology, when we identify pathology, we need to have this critical thinking and investigative mindset. Wait, if pathology is here, it's going to be somewhere over here. Or if something that I find here, then there's probably something over here as well. Okay? Am I persistent in achieving my goals, or do I give up easily? Remember, that's not good enough. Do it again. This is not at the standard that we need. You need to do it again. Can't do it today? Okay, try again tomorrow. Okay, we're going to do that to you in lab and in clinical, because raising you to this specific standard, we want you to come out scanning at entry level when you graduate from this program. And then last but not least, research these professions, guys, are not the same thing. They're not the same thing. Okay, so see what you want to do. Be a cardiac sonographer, be a general sonographer, and then choose. So at least that's my encouragement. Contact information for general questions. I showed you our website. For general questions, you can send emails to this email here. I want to take a picture of it. Ms. Sandra Crockett, who is in the front desk of our suite, she's the one answering emails. She's the one forwarding them to respective personnel, our workforce assistant, our advisors, etc. Please be nice to her, okay? You can go up and see her if you want to. She's my gatekeeper. She will not let you come to my office unless you have an appointment or, things of that sort. I really love her. Just be nice to Sandra. Here's the rest of our team. We have our new full-time workforce advisor, Jessica. Jessica, are you here? Where's Jessica? She not here? She left. We scared her away. Anyway, our other part-time workforce advisor is Ms. Linda Pingman. She's back there. They're very knowledgeable guys. If you have questions about, does my course transfer, or I went to this other institution and I took this course, etc., they'll be happy to answer your questions. Oh, there's Jessica over there. So she's our full-time workforce advisor. So, and also Linda takes care of the advising part as well. Ms. Diana Pena, who I love very much as well. Where are you, Diana? She's over there. She's a workforce assistant, but I try to grab her because, again, look how popular our program is. Okay. So lots of questions for sonography. She knows the ins and outs of the program. If she doesn't know, if she's unable to answer your question, because it's just very detailed or what have you, she'll send me over those emails, okay? But again, be nice to our team, guys. They're here to help you. They're here to try to guide you the best way possible to try to get into our programs and to give you the most accurate information as possible. And just some advice, whenever you email us, just include at least minimum these things so that we know where to immediately respond or forward your email to the appropriate personnel, et cetera, et cetera. All right, that concludes my presentation. Thank you very much. We will be taking questions from the students here. The microphone is right in the center, okay? So if you have questions, please line up and I'll answer your questions. WebEx people, please, I would, if you're logged in via WebEx, I would maybe wait to see what questions this group has that's live. And after that, definitely send us questions via the chat feature, okay? And we'll take care of you guys online. All right, so Who's first? Don't be nervous. Can't be nervous. We're shy.
Okay, so, my question is more so for like the clinical side of things, cause, I'm putting myself through college, so I work. And, my more so question is, are they like, will they work with you? Cause I work at MD Anderson, so my schedule is very steady. I work overnight. So if I have to be at work at 7 o'clock, but I'm all the way in College Station, and I told the academy to work at 7, are they gonna allow me to leave at like 5 to be able to get to where I need to be, or is it very just cutthroat, like, no, you have to be here, sorry, figure it out? Basically.
Sorry, figure it out.
Thanks.
You gotta choose. You want to be in the program or do you want to continue working? And I know you're kind of in a bind, but when students ask me, Director, should I work during the program? Initially I say no. Because it is a full-time program. Like you said, you gave a scenario already. If I'm at Bryan College Station and I have to go to work by 4 p.m. at Medical Center, probably not gonna happen. We're not gonna adjust your schedule just for you, okay? So again, initially I say no, don't work, okay? If you say I have to work, I'll tell you, okay, but work part-time. Maybe in the afternoon or maybe on the weekends. And then thirdly, I'll say, if your grades are coming down, we need to have a conversation. And you have to choose. I really want to be a sonographer. I got to do whatever it takes. I don't know what that is for you. Or I'm going to continue my career at MD Anderson. Is that reasonable to say? Tough situation, I'm sorry.
Yeah.
But I'm being honest with you. Yes.
So I have tattoos on my arms and you said not to show them. Is there a long sleeve option for the uniforms that's provided?
Yes, there is. We usually require like a white long sleeve that goes underneath your scrub.
Oh,
So you,
so
yeah,
I
that's fine. No problem.
And then my second question is, I have Invisalign, and so I have my appointments on Saturdays once a month. But you said sometimes we'd have to work on, or clinicals to be on the weekend. What would I do in that situation? Because they're only there one Saturday a month. Okay.
You gotta work it.
I'm currently taking sociology right now, but if I apply when I get enrolled for that camp, would that 1 point go towards my mix? Mix?
No, and correct me if I'm wrong, advisor. So you want to submit your application, once that sociology course is in your Lone Star account, then submit your application and then those points will be added. If you do it now, you won't get those points. Am I correct, advisor?
Right, the application is open
So
2
then-
weeks after the application is open 2 weeks after the semester ends, so you'll have plenty of time. It takes like 10 minutes to do it. But just have everything ready, the USA test done, you can have everything printed out and then submit once you've got that grade in there. Otherwise, you do not get that 1 point.
Thank you.
Sorry, I'm on the call. But my name is Erica.
That's all.
And my question is regarding the test that we have to take to be able to apply, which is a USA test. Is there any practice that we can take, or it's just we go in there blindly, see how it goes?
Correct.
And you can also be able to talk a little bit about your experience with the test, right?
You or me?
You.
I've never taken the test.
Okay.
I'm already a sonographer.
Okay.
Welcome.
So I know in the process worksheet, it says that the transfer credits. So I mean, personally, I didn't get to take the intro, but I did take if 1 and 2 at a different college. Would that count as that point, or would it count as like a transfer, which is only 6 points compared to like this? I got an A and it's 12 points.
We'll take the biology 24-1, 24-2, as long as they're less than 5 years old, and the sonography application will pull the highest of the grade. So if you got an A and a C, it'll pull the A.
And it'll count like for like let's say 12 versus 6. Thank you. As far as the application, are we able to know
how many points is a hopeful amount for us to make it into the program?
No, that varies between year to year. So, I mean, you'll know how many points you have, but no, we're not going to share with you, well, you need to have at least 70 to make it. Yeah, it will differ between year to year.
Okay, thank you.
Hello, my name is Cecilia Fernandez. I just have a quick question. For the clinical rotations, is there any time that we have to go or it will be randomly?
The clinical coordinators will schedule you every semester to a specific site.
Okay, but it will be in the mornings or afternoons, or it just depends, whatever they have.
It depends, right? It'll depend what's available.
Okay.
Again, our goal is to keep it during the day shifts.
Do you have any idea, like if it's, what will be the latest?
Sorry,
What will be like the latest, like the time, the latest I'll be able to call this thing?
I can't tell you that. And you'll find out in the, once you're accepted, the clinical coordinators will send out the schedule about midsummer.
Okay,
So
thank you
you
so
will
much.
know.
Will this presentation be available on the website, NAMSTAR website?
Yes, as you notice, we're recording and it's, via WebEx. I'm gonna have to edit a few things, but eventually my goal is to upload it into a website.
Okay, and my next question is, beginners or kids? That'd be like an unpaid type of internship or shadowing for the parents.
Unpaid.
Hi, so I graduated from Texas A&M a few years ago, and I'm currently taking my prereqs, 2 prereqs right now. I'm assuming, do I need to still like resubmit my transcript since I'm already taking prereqs right now at the start for the program, or?
As long as you have your A&M transcript in, and you're taking the classes at
Okay,
Lone Star, you're fine.
okay, just waiting until I'm done.
Right,
So-
wait till you're done and then apply.
Okay, perfect, thank you.
How many alternates do you guys typically take, and how long do we have until we're not able to do the program? Like if someone drops out, like how late into the program would you take alternates?
Sure. So we took 4 alternates for each program this past year. We probably by midsummer, you would know. I mean, let me give you a worst case scenario. We won't go 2 weeks. So let's say, well, the program starts in the fall. After the 2-week marker, fall semester, we're not considering alternates anymore. If you haven't been called or what have you, then just assume that you didn't make it.
Okay, so my question is, can somebody apply to your smart grid program, but also apply to different smart grid program?
That's totally up to you.
Okay, and my second question was, so they both need the Pegasus test, so you can only take it once, or would I ask that person to take it one over here and then one over there?
Are you talking about another institution, another college?
Yes.
Well, I don't know. I mean,
But.
for us, we require the USA exam.
Mhm.
Other colleges or institutions, we don't know. I mean, we don't know if that's a requirement. So you need to research that. But as far as the USA test, taking it once, yes, you're only eligible to take it one time.
Okay, so what if the other college needs that same test too? Would that, that would interact?
Again, you have to speak to them and ask them.
Gotcha, thank you.
You're welcome.
Hi, this is in regards to state transcripts. I just turned mine in, but I'm wondering, should I just contact the registrar to see if they can be evaluated, or should I contact? Last slide.
They generally take 3 to 6 weeks to be evaluated, so just watch your Lone Star account. You'll see the grades go in there, there'll be a T in front of the grade, and it'll show you what counts. And then you can email one of us, and we can go through it with you to make sure you have everything you need.
Hi, I was just wondering what kind of equipment you guys use in the office?
Like the manufacturer?
Yeah, like how, where your machines, are they?
We have,
Are they new?
yes, they're new. We have some that are 10 years old, but we do have some new ones as well. So
So in the echocardiography lab, are you guys using like Philips, GE?
We are.
Bose,
Yeah.
Cross training, both?
Yes, we have different manufacturers. We have different systems with different manufacturers, yes.
All right, thanks.
No, I was wondering if the tests are national certifications or just state certifications, but state of Texas.
National.
Oh, thank you.
So, I'm not making any assumptions here, but, I saw that it was the mandatory new student orientation thing, like you said, it was in mid-July. Like this summer, right? But during the summer, if I get accepted, I'm not like making any big assumptions here, being like very pessimistic.
We like the confidence, we like the confidence.
My family is going to be out of the country in like for most of the summer. But if I do get accepted, will there be any like opportunities for me to also go to it, or like some sort of like make up for it or substitute for it?
We'll cross that bridge when we get to it. So we'll just, once you're accepted, we'll discuss.
Okay, I just wanted to. Thank you, sir.
Is it for new student orientation for the admission process? Is that what he asked?
Once you're accepted, there's a mandatory new student orientation for our program.
Yeah, but for you, not for Lone Star. Okay, I just wanted to make sure. I was gonna say, we have some he can do on demand, that's all.
My question is more about the credentials. So I know to become a neurosonographer, you no longer have to be accredited by the normal program. It's more on the children nutrition, PCIS. Is that true? Because you don't have.
When you say neurosonographer, can you be more specific?
Um,
You're talking about
so
neonatal brain?
They have normal sonography, they have echosonography, and they have neurosonography. Once you do the board exams to the department that you kind of want to go to. So I know you have to take, when you do your board exam, you have to take different credentials, like the ARDMD or the PCIS. So I know this year, I don't know if it's just Monster, it's everywhere, where you don't have to do the neural credential anymore, you can just go under pediatrics.
I don't think there's a neurosonography credential anymore. It's.
Yeah, you want to research that yourself. We're not familiar with that.
I have a question regarding the math. I took the algebra, I got a B. I have also, I took a pre-calc, got an A. Will you take a pre-calc over my algebra?
Yes. So we'll take a higher math class, the trig counts, pre-calc, calc 1, calc 2.
Okay.
A question about the physics. My elementary physics course didn't transfer over. I think it's like mine to a pediatric cardiac sonography. So, but I have a university, I guess we guys call it university physics course. It's calculus-based physics. I noticed that you said you take college-based physics, but do you take the university physics instead?
Unit transfer, and it's physics 1401.
I'm not sure yet.
We'll take physics 1401 in place of physics 14. Yeah.
But you won't take the university physics.
If it's transferred in, it's 1401. I think that's.
But if that's college physics.
Okay.
University physics is the calculus-based physics.
Is it 2425 and 426?
Yes, it is.
Is that, okay, then we do not take that.
My questions about the transfer. I have friends that were originally from a different college, but I've already previously transferred them to Lone. So do I still need to go back and get the transcript credit?
As long as all your official transcripts are in and all your grades that you took someplace else are in, you do not need to send another transcript.
Okay, thank you. Would y'all take statistics from?
No. Not for this, not for the sonography.
So, you said the USA test is going to take consideration of the clinical and the physics or not physics?
We're looking at the clinical score initially, where there's ties. In order to determine the tiebreaker, we will look at that physics component.
And let's say you find both programs intriguing, you apply to both, is that a problem?
You can apply to both.
What's that?
You can apply to both.
Okay, thank you.
We would say exam like pretty serious, right? We're going to take it again next year. Or once we do your test.
Guys, I can't hear the student question. Can you repeat?
So like, let's say we take the USA exam already, it's this year, are we able to take it again like since it's a new year, or once you take it, it's just you're taking points?
Just one time. Diana, do we have any questions via WebEx?
So I have to take the exam before I apply.
Yes.
My AFP of 1.5 years, do I accept the refresher proposal?
Yes.
Hello, so my question is kind of piggybacking on someone else's question when it comes to specialties and everything. So for research, I think it's different specialties, vascular, sonography, et cetera. So when it comes to wanting to do specialties, would it be smart to do general sonography or to go into echo? Because I did speak with an advisor and I spoke with him about maybe seeking a bachelor's degree in sonography. So would it be better to do general or to do echo if you want to, specialties? I know you do get vascular in the program as well.
Are you talking about pediatric versus adult or just specialties in general?
Specialties in general.
Well, with general sonography, we train you in different specialties: abdomen, OBGYN, small parts. In cardiac, it's basically just cardiac, just heart.
Okay.
So it's your preference.
Thank you.
I think that's something you just with physical disability, but you're saying that with physical disability, it's very possible to succeed in sonography or
As long as you can perform the duties of a sonographer. Once you're accepted, we do require a physical examination that you need to pass via your doctor.
So now I'm taking the biology class and physics class, and I believe those classes will close on May 15 or something. So that means that I only have 1 or 2 days window to apply. So is there any way that I can submit my application before I got the grade from those classes?
The deadline for the application is May 23rd. So if your courses end on the 15th, you have about a week or so.
Oh,
You'll have time.
okay, thank you, sir.
I took the CPR with the American Heart Association last year. Will I have to redo the CPR with a different course, or will it still be valid than what I took last year?
It's okay. It's been 2 years.
So your certification should be good for 2 years. So if you do get accepted, yes, that is a requirement, and our clinical coordinators will just verify that it's the correct one and that it's not expired.
Thank you.
My question is, if you guys look at applications in a specific order, asking for those of us who are finishing classes this year, are you looking at the applications of those who submitted them now first, or is there?
No. We'll accept the applications with the highest points. no matter when you turn it in, whether it's at the beginning of the application process or at the end. No more questions? All right, thank you so much for attending, guys. Good to see y'all. See you soon.
I'm good too.
Oh, I haven't seen this. Sorry, I didn't recognize you.
I know, no problem.
How are you?
I'm good.
Yeah. Dr. Barrett mentioned that your daughter's interested.
Oh, yeah.
Is she here?
I just wanted to say thank you.
You're welcome. Okay, yes. Nice to meet you.
She was, watching.
So she bought, okay, good.
But
Yes, I apologize for February. I was out sick and you know, it was just a mess, but yeah, that's why we were able to do this webinar for the students that actually came and we appreciate it.
exactly, yes, I like that. But I just want to say.
Okay, yeah.